Welcome back to Wall's Nursing Videos. Today we're delving deep into the realm of anxiety medications and psychopharmacology. Strap in as we explore the mechanisms of action and potential side effects of two main classes, benzodiazepines and buspirone, along with a glance at other classes used in anxiety disorder treatment. Let's kick things off with benzodiazepines. These drugs are the go-to choice for managing anxiety due to their rapid onset and effectiveness. Mechanistically, benzodiazepines act by enhancing the inhibitory neurotransmitter gamma-aminobutyric acid, GABA, in the central nervous system. By doing so, they effectively calm hyperactive brain circuits, bringing relief to individuals experiencing anxiety. However, despite their efficacy, benzodiazepines come with a laundry list of potential side effects that every nurse should be aware of. These include physical and psychological dependence. Prolonged use of benzodiazepines can lead to tolerance and dependence, making it challenging for patients to discontinue the medication without experiencing withdrawal symptoms. Central nervous system depression. Benzodiazepines can cause drowsiness, confusion, and impaired coordination, potentially increasing the risk of falls and accidents, particularly in older adults. Hangover effect. Some patients may experience residual drowsiness or cognitive impairment the morning after taking benzodiazepines, affecting their ability to function optimally during the day. Tolerance. Over time, patients may develop tolerance to the effects of benzodiazepines, necessitating higher doses to achieve the same level of anxiety relief. This escalation in dosage increases the risk of adverse effects and dependency. Withdrawal symptoms. Abrupt discontinuation of benzodiazepines can trigger withdrawal symptoms, such as rebound anxiety, insomnia, tremors, and even seizures in severe cases. It's crucial for nurses to educate patients on the importance of gradual tapering under medical supervision to minimize these risks. Now, let's shift our focus to buspirone, a lesser-known but valuable alternative for anxiety management. Unlike benzodiazepines, buspirone works by selectively activating serotonin receptors while having minimal effects on GABA receptors. This unique mechanism of action makes buspirone less sedating and less likely to cause dependence compared to benzodiazepines. Despite its favorable profile, buspirone is not without its own set of side effects. These may include dizziness. Some patients may experience dizziness or lightheadedness, particularly when initiating treatment or with changes in dosage. It's essential to advise patients to avoid activities requiring mental alertness, such as driving, until they know how buspirone affects them. Sedation. While buspirone generally causes less sedation than benzodiazepines, some individuals may still experience drowsiness or fatigue, especially during the initial stages of treatment. Nausea. Gastrointestinal symptoms like nausea and upset stomach are relatively common with buspirone use, but they often improve with continued treatment. Headache. Headaches are another potential side effect of buspirone, although they tend to be mild and transient in nature. Patient education is crucial for ensuring the safe and effective use of anti-anxiety medications. Let's break down each aspect. Safety measures. It's important to emphasize safety precautions to prevent accidents or injuries while taking anti-anxiety medications. Advise patients to avoid driving or operating heavy machinery until they understand how the medication affects them. Encourage them to stay vigilant and avoid potentially hazardous activities if they feel drowsy or lightheaded. Avoidance of alcohol. Alcohol can interact dangerously with anti-anxiety medications, increasing the risk of severe sedation, respiratory depression, and even overdose. Educate patients about the importance of avoiding alcohol entirely while taking these medications. Remind them that even small amounts of alcohol can have significant effects when combined with benzodiazepines or buspirone. Avoidance of abrupt discontinuation. Abruptly stopping anti-anxiety medications, especially benzodiazepines, can lead to withdrawal symptoms that can be uncomfortable and even dangerous. Educate patients about the importance of tapering off these medications under medical supervision to minimize the risk of withdrawal symptoms. Encourage them to discuss any concerns or difficulties with their healthcare provider. Buspirone and serotonin withdrawal. While buspirone is generally well tolerated, sudden discontinuation can sometimes lead to a discontinuation syndrome characterized by symptoms such as dizziness, nausea, headache, and anxiety. This is not the same as withdrawal from benzodiazepines, but rather a reaction to the abrupt change in serotonin activity. Patients should be informed about this possibility and instructed to consult their healthcare provider before stopping buspirone. Benzos and seizures, benzodiazepines, when abruptly discontinued, can lead to a rebound effect, increasing the risk of seizures, particularly in individuals who have been taking high doses or using them for an extended period. Emphasize the importance of following the prescribed tapering schedule and seeking medical advice if experiencing any unusual symptoms during the discontinuation process. Stress the severity of seizures and the potential for life-threatening consequences if benzodiazepines are stopped suddenly. By providing patients with comprehensive education on these key aspects, nurses can empower them to take an active role in their treatment and minimize potential risks associated with anti-anxiety medications. Encourage open communication and address any questions or concerns they may have to promote safe and effective medication use. In conclusion, understanding the mechanisms of action and side effects of anxiety medications is essential for nurses to provide comprehensive care to patients with anxiety disorders. By equipping ourselves with this knowledge, we can better support our patients on their journey towards mental well-being. Stay tuned for more nursing insights, and don't forget to like, subscribe, and hit that notification bell for future updates from Walls Nursing videos.